Now coming to the clinical features. Clinical features of Shigella. Incubation period. Incubation period is incubation period is 1 to 4 days. Incubation period is 1 to 4 days. Initial phase. Initial phase. There is watered area. Watered area. Watered area. Later on, mucopurulent area. Mucopurulent stools. Bloody. This is known as dysentery. This is watered area. Later, mucopurulent stools. This is known as dysentery. Phase of complications. There is phase of complications. Phase of complications. Phase of complications. Complications in children less than 5 years of age. Less than 5 years of age. Phase of complications. One is toxic megacolon. Toxic megacolon. What is toxic megacolon? There is something called Hirschsprung disease. That's called toxic megacolon. There is something called Chagas disease. That's also called toxic colon. Megacolon. That is not toxic megacolon. That is megacolon. Chagas disease is also known as mega disease. Mega disease. Then toxic megacolon. Then perforations. Perforations. How do you explain these things? Like I have told, like we have seen in the previous topics, like we have VMA, virulence marker antigen. What does this cause? This causes invasion. This causes invasion. Right? Since this causes invasion, this is responsible for invasion. Hence, there can be toxic megacolon because mesenteric plexus can be damaged due to invasion. Since there is invasion, there can be perforation. This can be explained on these things. Then comes metabolic complications. Metabolic complications. What can be metabolic complications? First, hyponatremia. Why hyponatremia? Due to dehydration. Dehydration per se is a complication actually. Due to loose stools. This is due to loose stools. Due to loose stools, dehydration, hyponatremia. When there is hyponatremia, what about glucose? How glucose and water is related? Glucose also is responsible for osmosis. Sometimes, not every time. Most of the times, 99% of the times, it is always associated with hyponatremia, dehydration. Sodium and water are always related. But when there is severe dehydration, even the osmotic agents like glucose also lose out. This causes hypoglycemia. The hypoglycemia can also be explained through mucopurulent stools. What is this mucopurulent stools? What is muco? This is mucoid. What is mucoid? What is mucoid? It contains mucus. What does mucus contains? GAGs, IgA, like, and other nutrients like glucose, and there is loss of blood. There is loss of blood. When there is loss of blood, there is complete invasion. As a result, there is leak of blood. If there is leak of blood, then what is it? If there is leak of blood, then there should be loss of glucose also. Loss of glucose also. Mucus. There is loss of mucus. Very important. There is loss of mucus. Breach in the mucus. There is ulcers. Ulcers formation. Partly blood. Glucose also. Hypoglycemia. This can be explained on this also. But if I were to explain this topic, then I should have considered other nutrients also, like potassium should also have been lost. Then other things like protein should have also have been lost. But why only glucose? That's also a question. So basically, to explain that, this I think this is more suitable answer to that question. Right? This is hypoglycemia, hyponatremia, dehydration. Now comes one syndrome, that is Ikiri syndrome. Now, Ikiri syndrome. Let me pause here. Let me ask. Shigella Sone typing is colicin typing. Shigella Sone typing is colicin typing. What is non-salmonella type organisms? What is Salmonella colyriusis, right? Then what are those broth medium which has quite tongue twisting? That is tetrathione broth. First one is tetrathione broth. Second thing is enteric agar. Ecthionate something. Hectoin. It is hectoin. Tetrathione. Colyriusis, colicin, medicine. It is colicin taping. Now comes Ikiri syndrome. This again tongue twisting name. Ikiri. Do you know what is Hirakiri? Do you know Hirakiri? What is Hirakiri? Seppuku. That comes in forensic medicine. That is Hirakiri. That is not today's topic. It doesn't mean that I don't remember it. I know it, but I don't want to cover it because it is not related to today's topic. Ikiri syndrome. Ikiri syndrome is toxic encephalopathy. Let me, for everybody's convenience, let me cover Hirakiri. What is Hirakiri? See, in case of war, especially the Japanese wars, these Japanese soldiers, they would kill themselves by stabbing their stomach, so that the abdominal contents will come out and person will die due to shock. Why? Because to avoid getting caught by enemies. It is like a pride, for the sake of pride of their country. They consider it shameless to be caught by the enemies. Hence, in such cases, they kill themselves. Hirakiri, also known as seppuku. That comes in forensic medicine. Now comes Ekiri. The names are similar. Hirakiri, Ekiri. That's why that came into my mind. Ekiri, toxic encephalopathy. Decree is metabolic complications are present. Neurological features are present. Delirium, confusions. Metabolic complications are present. See, brother, here it is mentioned, you see, toxic encephalopathy. Why there is toxic encephalopathy? What is like? See, we have to understand the basic fundamentals. Why there is encephalopathy? Some metabolic defect. It is most commonly encephalopathy is metabolic defects like hepatic encephalopathy, uremic encephalopathy. We have heard these things so many times. Uremic encephalopathy. If there is encephalopathy, there should be neurological features. There must be neurological features. If there is neurological, in late stages of encephalopathy, there is delirium and confusion. This is present in all encephalopathies. Delirium and confusion, it is present in the late stage, like stage 3, stage 4. It is hepatic encephalopathy stages. In encephalopathy stage, in the late stages, there is delirium and confusion. This is toxic encephalopathy. Is also known as Ikeda syndrome associated with Shigella. Let's revise the things, right? What is incubation period? Incubation period is Shigella is 1 to 4 days. Initial phase, watery diarrhea, later on mucopurulent discharge, that is dysentery. Then water complications, see there is invasion, hence toxic molecule, hence perforation. This is complications. Now comes metabolic complications. There is loss of water, hence there is dehydration, hence there is sodium loss, hence there is glucose loss. And there is Ikeda syndrome, that is toxic encephalopathy. Metabolic complications as in, see, toxic encephalopathy, confusion. Okay, we'll